We are back here at Atlantic Health System, home of Atlantic Sports Health, with Dr. Daniel Harrington, talking about runner's knee, or known as Patellofemoral Syndrome, and how to overcome it and or prevent it and treat it, right? And we talked about different exercises we can be doing to help this pain. So, Doc, you talked about having weak glutes and core. What are some of the exercises you like best in terms of treating this issue?
Sure. So squatting, lunges, clamshells, all are great for the glutes.
You know, I read a study that clamshells have some of the highest activation for glutes. So the clamshell exercise, when you do that exercise, you don't need any equipment, which is nice about that one. And just your own body weight and just opening and closing that knee really fires the glute. I think most people don't realize we're sitting all day and the glutes are in a lengthened position. And being lengthened all day long, they tend to relax and quote unquote kind of shut off or not be too activated. And when they're not firing, you know, it causes a challenge because we need the glutes to fire to be able to move and be mobile. What else do you like?
Planking.
Yes.
Planking is a great ab exercise.
Yes.
Stabilization stabilizes your back as well.
Yep. I love planks. I love also simple crunch, but the crunch we do, they call them the gill crunch, where we just bring the shoulder blades off the ground only about an inch, and the head doesn't move much, and it's really an isometric contraction. So raising off the ground and really bracing the core. You know, I think a lot of times people just don't understand how to brace or to brace to activate the core, as if imagining someone's going to punch you in the stomach. You're going to stiffen and create and activate. Side planks are also great as well, right?
Absolutely.
We also like bird dogs for the low back. You know, another great movement. Anything else that you would add or you would share in terms of prevention or treating this issue?
Sure. I think all those were great exercises, and doing all of those will certainly help. A screener that I do in the office is having them do a single knee bend.
Yes.
And I watch how that knee tracks, if it's straight up and down or if it kind of caves in a little bit. And that caving in contributes to the kneecap tracking outwards. So anything, if you can correct that with all of these exercises, you'll go a long way.
That's a great self-assessment too, to do a single leg squat and just see where that knee is tracking, if it's going to the left, right? Because typically we go to the left or the right. Would it go to both sides?
If you cave in, or what we call valgus, knee valgus,
yes.
and if your knee caves in, then your kneecap will track outwards.
Right.
So we want to see that knee goes straight up and down.
Straight up and down, over the big toe? Yes.
Exactly.
Really, really important. Great assessment, great stuff. Thank you so much. And hopefully you guys can benefit from this. Start some of those movements if you're not doing them already to prevent patella pain for sure.